When you can have sex after childbirth. The timing of the resumption of sexual activity after the birth of a child depends on several factors: how the birth went, physiological, pathological, with ruptures or cesarean section. General well-being of a woman after childbirth. Whether the uterus has completely contracted and the cervix has closed to prevent infection. Whether the woman has undergone psychological adaptation to a new life. General recommendations of doctors are usually as follows. If the delivery was physiologically normal and there are no tears, sexual relations can be resumed 3 to 4 weeks after delivery. If the birth was pathological, there were tears or incisions, or the child was born by cesarean section, then it is optimal to start sexual relations not earlier than 6 to 8 weeks after the birth of the baby. Of course, provided that the woman feels normal. Deviations from the recommended abstinence periods. Not all women after childbirth adhere to the abstinence periods recommended by their gynecologist. Some resume sexual relations earlier, others, which is much more common, do not have intimate relations for 3 or more months after the birth of a child. In both cases, there are a number of reasons why women do this. The presence of a woman after childbirth euphoria, that is, psycho-emotional upsurge. As a rule, this condition occurs only after natural, uncomplicated childbirth. The woman's desire to return to the usual form as soon as possible, to feel desired, to improve her own self-esteem. In some cases, a woman is pressured by her partner, whom she is trying to please. If during pregnancy there was a forced absence of sexual relations, for example, for medical reasons. If after giving birth a woman has a significantly increased libido, strong excitability appeared. Reasons for the late onset of sexual activity after childbirth. Chronic fatigue of a woman. Fear of possible pain. Decreased sex drive as a result of natural changes in hormonal levels due to lactation. Fear of a woman that the vagina is too stretched, and the partner will notice it. The child absorbs all the time, and sexual relations fade into the background. Temporary psychological difficulties in the relationship with the partner associated with the appearance of the child. Domestic difficulties, for example, relatives can stay and spend the night in the house to help with the child. Difficult process of adapting to the child's sleeping schedule. The state of health of the woman does not allow to enter into intimate relationships. The benefits of sex after childbirth. If you follow the recommendations of the gynecologist and resume sexual relations after childbirth on his recommendation, then, without a doubt, the body will only benefit from this. The main positive aspects of sex after childbirth are as follows. Strengthening the walls of the vagina, which could be stretched or deformed during childbirth. Improvement of metabolic processes in the body. Restoration of mental and emotional intimacy of the spouses. The ability to quickly lose weight after childbirth and return to its former form. Hormonal surge. Improvement of the heart, blood vessels and respiratory organs. Prevention of many diseases. Rejuvenation effect due to the release of endorphins. Regulation of the menstrual cycle. Relief of psychological stress. Improvement of self-esteem. Feeling of fullness of life.